That's on now, right? Okay, I'm just double checking.
Let me just double check with the participants.
Okay.
Why don't you say like, can you if you can hear me in the Zoom, can you like go ahead and put a chat out or put in the chat that you can hear me.
If you guys didn't hear me, just give me a thumbs up or say in the chat, we're good to go.
No one responded, so that makes me feel. Oh, Ariel, you have a thumbs up. So
Nice. Okay, great. So I think I'll go ahead and actually get started and make this super short and sweet. So I will be doing a presentation on sports nutrition for the young athlete and kind of the basics of like what to eat and what to avoid. And no financial disclosures. I think Dr. Mo wanted me to introduce myself to the community, so I have a slide of where I'm coming from. I did my medical school at Michigan State. I did my pediatric residency at Kaiser, and then I stayed on an extra year to do my sports fellowship at Kaiser as well. And I'm currently doing sports medicine practice here at Spark. So I do the ultrasound guided procedures, musculoskeletal ailments, and also some concussion care as well. And my other side of the job is primary care pediatrics, and I work at the Children's Clinic for Rehabilitative Services, and I'm in that primary care department, and I also am taking over the cerebral palsy multidisciplinary clinic as well. And to go over some of the objectives of this presentation, I do want to provide a general guideline to some healthy eating habits for the average pediatric patient and to understand the basic pediatric energy needs, to discuss some of the macronutrient and micronutrient needs, and to discuss some commonly used dietary supplements. And in particular, I think I'm going to be focusing on creatine. Also gaining some insight into the difference in energy and dietary needs of children and adolescents participating in sports particularly. It also outlined the needs of an athlete with special circumstances. So I'm going to include an endurance athlete and also the athlete with type 1 diabetes. And we'll go over that together. So just some general information as an introduction. The adequate nutrition during childhood can definitely have a profound effect on the physical and mental development. And 75% of children actually take less than the recommended amount of fruits and vegetables. So in children who are greater than 2 years old, they should actually include about maybe 30% of their caloric intake from fats, and I'll go over a little bit that into more detail. And 25% of adult bone is actually accumulated around the 2 years of their peak bone growth velocity, and that we think about like times of puberty. And so going over some of the pediatric energy needs, so we think of like the macronutrients, I guess. It's the fats, the proteins, the carbohydrates. And I just want to kind of go through like the evolution of like the food pyramid scheme kind of a thing, where in the 40s and 50s, it started out as this wheel of groups of foods. And eventually it becomes this kind of food guide pyramid where you have your carbs, your breads in the end, and it kind of builds up into like your fruits and vegetables, milk intake, and so on. And then it becomes a more like equalized pyramid. And now we look at our CDC website, and it has now this healthy eating plate where it divides your daily intake into a plate and portions. So pediatric energy needs. So, nutritional considerations of athletes. So, they definitely have a greater protein need per kilo of body weight for their growth. So, there are definitely greater calcium needs to support their bones. And there's definitely a higher metabolic cost of movement per kilo of their body mass. And so, there's a relatively more fat use during exercise as well. And I'll go into a little detail later on regarding um, fatty acid oxidation during exercise. And also, sweat electrolyte losses also differ between children, adolescents, and adults as well. And when we think of kids or younger kids, dehydration is more detrimental to children than adults due to their greater body surface area. And when we think of like our growing athletes or going into the adolescent college age, there's definitely some more of a practice of weight control, and that could be a threat to energy intake. And so we want to make sure we kind of counsel them on limiting body mass reduction to probably less than 1.5% per week, and usually it adds up to maybe a pound per week. And when we think about like weight loss or healthy weight loss or something that's more maintainable. And here we kind of look at the pediatric energy needs, and this is from healthychildren.org, which is a great resource for a lot of pediatricians. And this is just to give an example of the different ages of basic caloric needs on a day-to-day basis. We give you an example of a sedentary, kind of not so active pediatric patient and divided into moderately active and active. We can see the ranges of calories and the amount they need in terms of age and how much activity is done on a day-to-day basis. So of course, the more you exercise, the more energy you use, the more calories you're going to need to intake. And then on this left side, I'm sorry if it's a little bit hard to see, but it's to kind of give you an idea of like, hey, what does a 1400 calorie day look like? So for example, it might be like a cup of fruits, another cup of vegetables, some grains, proteins, and fats, and so on, or dairy products that can add up to protein as well. And when we think about pediatric energy needs, we also think about if they're more active, what kind of sport are they involved in? So for example, if a patient is telling you, hey, I'm going to go bowling for like 45 minutes for one of these days versus another patient who tells you like they're involved in cross country. So they're going to be running for over an hour for at least several days of the week. So their energy needs are definitely going to be a little bit different. And that helps us counsel on like what they should have, what kind of intake they should be having. And going into macronutrients, so carbohydrates. So the glycogen stores are actually lower in children than adults because they have a less developed glycolytic capacity. And in one of the studies that I was looking at, they were curious. So they were like, hey, let's look through MR spectroscopy and assess this glycogen use in adolescents. And what they found was that there was a depletion of over a third of their glycogen stores after like a 45-minute soccer match. And then afterwards, they looked into their intake of carbohydrates. So they looked at that and saw that about maybe 4.8 grams per kilo per day almost restored the glycogen levels to pre-competition levels. So they may deplete it pretty fast, but with adequate intake, you're able to kind of replete it as well. And on this diagram here is just a reminder of where we mobilize our glucose, and that is in the liver and also in the skeletal muscle as well. Our other major macronutrient is fats. So children oxidize more fats than carbs versus adults during exercise. There's more fatty acid oxidation that occurs with a greater increase in glycerol, free fatty acid concentrations during these prolonged exercise. And that kind of makes sense because we don't have as many glycogen source. So then we use alternative sources of fuel, which in this case is the fatty acid oxidation. And then the older we get, or the more mature going through puberty, adult-like metabolic pattern develops towards the end of puberty. So even if children rely more on fats as an energy source during exercise, there's still not a lot of major evidence that we're like, hey, if they're an endurance athlete, or if they go through like cross country or longer activities, we don't know if they will benefit from an actual higher fat content in their diet. So that just goes to say that maybe 25 to 35% of your daily fat should be your intake, and no more than 10% of saturated fats. So that's just kind of your daily average intake. And then going into our other category of macronutrients is our proteins. So children and adolescents have higher protein needs than adults. In one of the studies, they were taking a look at a group of children who walked about maybe 45 to 60 minutes a day for a total of 6 weeks of time. And they found that the protein oxidation increased while the protein synthesis or breakdown decreased. And so to kind of echo that, in another study, there was some resistance training that was done on these children about twice a week for 6 weeks as well. And it kind of showed that they also had a down regulation of protein metabolism. So that kind of makes the point that in most circumstances, like with workouts and things like that, your standard daily average protein intake is usually actually adequate. And on this side of diagram, the minimum daily protein requirements, it would kind of break it down into ages. So for example, if it's like a toddler, 1 to 3 years old, they really need maybe 13 grams of protein per day. Versus if you're thinking about a school-age kid, maybe they need 19 grams. And then when they're going into puberty, they need 34 grams. So on that side, it's just to give you an example of how much of grams of protein that really is. So for a 34 gram in a patient going through puberty between the ages of like 9 to 13, they may need maybe like a string cheese or like half a piece of chicken breast and maybe some sweet potatoes. And that'll be like their minimum daily protein requirement. And going into micronutrients. So I'm focusing on a little bit more on iron. So iron deficiency anemia impairs aerobic capacity from a decline in muscle oxygen transport due to lower hemoglobin levels. So adolescent females are at higher risk for iron deficiency due to maybe more menstrual losses each month, or endurance runners are more frequently depleted in iron stores. And there is kind of an average recommended daily allowance for adolescents, about 18 milligrams of iron per day. And to kind of give you an idea of what 18 milligrams per day might mean is that you might need to intake maybe a few ounces of beef, some spinach. Beans are a great source of iron as well. And it's not just one serving, you probably need like several servings per day to make up that 18 milligrams per day. Another thing to emphasize on is calcium. So there have been calcium balance studies that show that children and adolescents have a higher calcium retention when calcium intake is low compared to adults. And 26% of their bone mineral density is accrued during puberty. So it's a very vital time to make sure that these children or adolescents understand that having some daily source of calcium is actually very important. And the recommended daily allowance from 4 to 8 years old, so like your younger elementary age kids, about 800 milligrams per day. And then from 9 to 18 years old, maybe 1,300 milligrams per day. And so kind of to give you an idea, how much that might be are some sources of calcium, such as a glass of milk might be 300 milligrams. But not everyone actually drinks milk nowadays. In my pediatric practice, I ask a lot of families, and they actually have a lot of alternative sources of calcium that's not from cow's milk, and that might be from like almond milk per se. So you want to make sure you kind of delineate that history if they give you an different type of diet intake at home. Other things that are non-dairy that have high sources of calcium. In this picture, you can see lots and lots of deep greens. So I like to counsel my patients in my pediatric practice is that just eating, so not just saying like eating a balanced meal of fruits and vegetables. When I say vegetables, I usually tell them the deep leafy greens, so such as like kale, broccoli, spinach, those types of greens, so that they understand what kind of vegetables to kind of look for. And moving on to dietary supplements. So creatine has actually been a pretty interesting supplement over the years. About 8.2% of teenagers of 14 to 18-year-olds use creatine. And in this study, 75% of those teenagers were kind of unaware of the amount that they're taking, or they were actually taking more than the recommended amount. So in these young adults and adult age athletes, it is believed to increase the muscle mass and the performance when they're doing these high intensity exercises. And initially we were thinking like, hey, we don't really recommend it in less than 18-year-olds because there's just not enough data during that time. And this is from 2009 with the ACSM. However, in the more recent years, there have definitely been more studies done on looking into the creatine and the effects on building body mass and how it affects your typical athlete. And in this study, it shows that with like proper supervision and supplementation in children and adolescents, that actually may be acceptable and can be safe and beneficial to their athletic activity. So on this chart, it just kind of gives us a little bit more information in regards to creatine. So what creatine does is that it can acutely enhance the performance of this high intensity, high burst exercise in sports. And the way it does is that it kind of increases the rate of this synthesis so that in the short term, you have these stores available so that you're able to continue these high burst exercises. And so there is a protocol of use where there's a loading phase where you take about 20 grams per day for the first week. And then afterwards, they call it the maintenance phase. So you take about maybe 3 to 5 grams per day in a single dose for the duration of that supplementation period. So how it impacts your performance is that it enhances this type of isometric strength, and you're able to do these repeated bouts of high intensity exercise. And so the further consideration, what to do, what are the side effects, things like that. So there really hasn't been much negative side effects that they found with the use of creatine, actually, with long-term use. And they found that there may be a potential of like increase in body mass, maybe 1 to 2 kilos, and that can be secondary to a little bit of more body water retention during the time of these use. So it's more to counsel your patients, like if you're asking them about medications, supplements, and they bring up creatine per se, this is a type of information that you can give them if they are supervised, if they're athletic trainers, coaches, if they have someone looking over and like asking them like, hey, how much are you taking each day, to give them this type of guidance. And if they're doing more high intensity or HIIT exercises, it can be beneficial. And to like let parents know like, hey, if we are supervising these things, it might be safer so they know how much they're taking versus not knowing at all and they're just doing it blindly. So there's a like kind of like safety factor where health providers can take that role. And then hydration. So hydration is another big thing during these activities. So the amount of fluid really just required depends on the age, body size, and activity level. So just a basic baseline, if there's like a sports event that occurs less than an hour, water is actually really enough and adequate. However, if they're in endurance activities, if they're doing a basketball game or they have club soccer, something like that, that is more than an hour, sports drinks are actually recommended. So about 6 to 8% of carbohydrates, and that is about 20 to 30 milliequivalents per liter of sodium, basically. So like your Gatorade or your Powerade. And so what to do before exercise. So sometimes parents may ask us that. And a moderately active athlete will need about 1,500 to 3,000 additional calories beyond their baseline. So that's a huge range. So that really depends on their activity level. So carbohydrate loading is actually not advised for younger athletes. And if they are to supplement themselves or get ready for practice or a game, a light meal of 400 to 500 calories a couple hours before competition is recommended. And we, of course, want to avoid high fat meals because it shows some delayed gastric emptying. Yeah. And then during exercise, so what to do? So sports drinks, gels, bars, they're marketed and they are definitely used and they could be actually very useful, but we want to make sure that this is something that's not it's not their only meal. It's used as like a supplement because there is a risk for childhood obesity. There is a risk for having dental caries or erosion. And so the effective carbohydrate drinks during exercise are actually not super well studied in children. In one of these studies that I found that they were looking at a group of boys and they were doing an hour cycling at 70% of their VO2 max. And they're drinking these like Gatorade or electrolyte solutions, but there was no perceived effect on like the exertion in them. So it didn't seem like it changed the boys perceived like how well they were doing during the cycling event. In another example, there's a carbohydrate drink during exercise, maybe improved performance time by 40% when these younger boys from the ages of 10 to 14 cycled at 90% of VO2 max. And these were non-athletes as well. So maybe if they were exerting themselves a little bit more or pushing themselves at that 90% VO2 max, these carbohydrate drinks can help a little bit. And then in another study that showed like there were 18 adolescents, they were doing these HIIT exercises for less than an hour. And then they drank like an energy drink or like Gatorade or Powerade. The highest, most notable symptom was actually it caused them a little bit higher GI discomfort. So in general, exercise greater than an hour, Gatorade or Powerade would be okay. However, if it's like less than an hour, like I said before, water is just fine. And after exercise, so what to do after? So water and sodium should be replaced if a lot of losses have occurred. So you're sweating constantly during a game. Sodium containing fluids and snacks help with rehydration by stimulating the thirst and fluid retention. So it's kind of a secondary effect. And recovery fruits, so what to do within 30 minutes. So you can eat within 30 minutes after your workout or exercise. And then again, so like a snack 1 to 2 hours after to kind of maintain that daily intake because you're using that much energy. And then going over athletes with special dietary restrictions. So we have vegetarians, we have vegans, we have a lot of different groups and populations that have different diet intakes. So for example, vegetarians, they can be more at risk for low intakes of energy, including proteins, fat, iron, calcium, vitamin D, so on. And vitamin B complexes as well can be found low in vegetarian female athletes. However, there is limited evidence if to show that if exercise increases the needs for these B complex vitamins. So the protein quality should be sufficient if like a variety of foods is consumed. Plant proteins are less well digested than animal ones, so there is kind of a general consensus to increase 10% of a vegetarian protein intake. Yeah, and then for vegans, so obviously there's a lack of animal protein. So there's limited lysine, threonine, tryptophan, all these building amino acids or proteins. So protein quality is obviously a concern. So sometimes you want to supplement a little bit more. Sorry, it's 5 to 25 grams protein per day. And some considerations if you're concerned, if this is kind of a long-term dietary choice, and you're concerned there's lack of. So checking some labs while you're in clinic, like a CBC, vitamin B12, vitamin D, it can be easily done. And some examples of these vitamin B complexes. So a lot of it, you notice that there's a lot of meat, a lot of those in the food groups. Cheese, avocados, those are things that can be manageable if we're not thinking about meat. So a lot of different alternatives you want to think about. Other examples of vitamin Bs. And then nutrition for the endurance athlete. So endurance sports include things like running, cycling, swimming, cross-country skiing. So a lot of these longer activities over time. So when we think of that type of endurance athlete, of course, fluids, it's going to be probably be greater than an hour of activity that they're going to be involved in. So we're thinking like Powerade, Gatorade, kind of a sports drink. Energy-wise, so for example, some people who are involved in swimming can be swimming for like 20 kilometers per day. And that can equate to amount of like 5,600 kcals of energy. And that's a lot. So you want to make sure they're supplementing that with their activity. So macronutrients, for example, to compare. So in protein, so for your basic sedentary patient or who's not really involved in sports, they need less than a gram per kilo per day of protein versus your super active or for someone who's going through a growth spurt needs almost double that, 1.5 grams per kilo per day for an adolescent. And so, for example, an 11-year-old who weighs like 30 kilos, we might think about 30 grams of protein, so 1 gram per kilo per day. So what does that mean in terms of food? And so we think about like, hey, is that like a breast of chicken? Is that a slab of steak? Is that a part of a salmon? So lots of meat. So we want to think about like, hey, if they're vegetarian, then we look at, then I'll probably reference to the chart in terms of like, okay, what can we do to substitute? Can we do more avocados? Can we do more vegetables and more lentils, more beans, and so on? And going to the micronutrients part. So iron-wise, we want to supplement at least 12 milligrams or greater than 12 milligrams per day, and calcium greater than or equal to 1,500 milligrams per day. And then last but not least, we'll go over a little bit about what we do for nutrition for the athlete with type 1 diabetes in terms of their carbohydrate intake, their hydration, and the electrolyte balance. So this chart is just to show there's kind of this nice routine where they are able to check their glucose at regular intervals to know where you're lying at so that we can prevent hypoglycemic episodes after a long physical activity. So nutrition for the athlete with type 1 diabetes. So if they're partaking in like aerobic exercises like running or something like that, it generally can cause a drop in blood glucose levels. And if it's even more intense, a mix of aerobic and anaerobic exercises. The reductions in insulin is actually not recommended. And so there can be a post-exercise hyperglycemia, and that could be managed with a conservative insulin bolus. But that goes to say, kind of looking at the 2-star bullets that I put, if they're partaking in activities for about 30 to 60 minutes, and they have this basal circulating insulin level, then 8 to 20 grams of carbohydrates should be enough for them to prevent hypoglycemia. And then with higher circulating insulin levels, so they may need a little bit more of carbohydrates to supplement. And then if it's greater than 60 minutes, so they're likely to require some kind of carbohydrate intake and or insulin reduction. So I think at this point, as primary care providers, obviously they will be in counseling with like a sports nutritionist and also an endocrinologist to help manage as well. And so there's definitely a little bit more math involved depending on what they're doing. And of course, with these athletes, you also want to emphasize hydration, lots and lots of hydration. So to kind of give you an example, what is 20 grams of carbohydrates? What would you say to a patient? So that could be a large plate of literally like fruits, vegetables versus like half a slice of a bagel. So that's like 20 grams equivalent. So that kind of gives them perspective into choosing what foods to eat and what foods to supplement during their activities. And so some conclusions from this talk is that basic pediatric energy needs are based on age and specific activity levels, but there definitely needs to be a balance between carbohydrates, proteins, and fats. So we're not avoiding any specific food group. You want to include all of them. And important micronutrients for an active growing athlete includes iron and calcium, which can be more easily met with a variable diet. And of course, we talked about like you're vegetarian and you're vegan, and there's definitely alternatives. So that's something to take note of. As far as endurance athletes, they do have increased energy requirements, and it makes it more important for us as healthcare providers to make efforts to avoid a caloric deficit that may lead to different characteristics, such as an athlete triad. And then to also just note that special considerations are needed for athletes with chronic disease, such as type 1 diabetes. So there definitely may be a necessity for multidisciplinary approach to help achieve an athlete's needs. So you'll need a nutritionist, you'll need a primary care provider, your coach, your athletic trainers, your physical therapist. If like caloric needs are not met, energy needs are not met, then we all can definitely work together to kind of come up with a plan so that the athlete can continue to do their sport, continue to grow, and not meet some of these issues or complications that may occur along the way. And I think that's it. I'll leave some time if there are any questions. I'll do my best to answer them, and we'll go from there.
Energy drinks were some of those classified within the caffeine.
Sorry, yes.
Okay, because I saw energy drinks, but I didn't see them actually as, because some of the students would use that as an energy drink versus something that actually has like real energy.
Yeah, I think when I talk about energy drinks, well, I'm really just talking about like Powerade, Gatorade, so electrolyte drinks. I didn't really go into my talk about things like with caffeine that have maybe more sugar content that might not be necessarily safe to take. That could definitely be a separate talk in terms of like supplements.
For the double shot.
Yeah, definitely
That's what they're gonna
not
deal
necessarily,
with,
recommended.
their prep. And then in a lot of your work or any of your work, what about the pre-game has always been kind of interesting to me. In cheering various foods within a 2-hour component as they build up to the day of the students don't have a lot of time.
Right.
And so they tend to, half of them are running out the door in the morning
Uh-huh.
and they really don't eat. They bulk up at lunch and then they try to do some kind of something before they go out on the field or whatever.
Yeah.
It just doesn't seem, number one, it just seems like a really bad habit. I don't think it really creates a conscientiousness about what their bodies need,
Right.
especially for the ones that want to go on as an athlete. But I didn't know if you had any kind of knowledge of a body of work or a special author or somebody that had a methodology that
Yeah.
incorporates the student lifestyle so that they actually have quality nutrients in prior to practice or
Can you
sports.
repeat the question?
Yeah. Okay. Sorry. The question to kind of rephrase is if there's any type of structure or tiering for a typical athlete, because a lot of the times these kids are rushing out the door and they don't have time to eat. And when they do have time to eat, they start eating too much and then it leads to other things or like unhealthy snacks. And that's a great question. I don't have like a particular source that to point you towards. However, I think as primary care providers, we can develop one or kind of just reinstate healthy eating habits in terms of like healthy snacks. And we talked about like energy bars, things like that, to make sure that we use them cautiously if there's no time to eat.
That's the go-to.
Yeah, exactly. So as long as we are understanding that it doesn't contribute to all of their energy needs because it's like a quick snack to go and that's the easiest part. It's a lot of counseling, putting time and effort, meal prepping. So all of these are very time consuming things that they may or may not be able to do. And that's kind of a family lifestyle change too. Yeah. That's a great question though. Yeah. Yeah. Nutrition is very interesting. There's a lot out there that I cannot cover in one presentation, but I'm happy to take suggestions and we can turn this into a series too. So,
So my children played soccer and golf.
mhm.
During soccer tournaments, they would have a snack in between.
Yes.
And then for one part of the year, they advocated like oranges and then that went by the wayside. What, what is recommended for mid-game energy? Good question.
Yeah, no, that's a great question. So the question was, so there are kids at home who are involved in sports and sometimes they go from like a different types of snacks and what is the recommendation of like a mid-game snack. A lot of the times of some of the resources that I looked at was actually drinking fluids. So electrolyte drinks should be sufficient to supplement during their time versus like an actual eating or a snack or something like that. So a lot of hydration would be the emphasis for these mid-game kind of breaks in between. Yeah. So not a lot of like, oh, what they should eat during in between these times or what types of foods, but it's more like they emphasize a lot of fluids during these times. Yeah, after the game. So it's kind of like a small site, like 30 minutes afterwards, you eat like a snack, a light snack. And then to actually supplement their whole game activity, it's recommended that they eat 1 to 2 hours later as well.
So I have students that tell me that they need to eat chicken
Mhm.
or some protein because they just did muscle breakdown. So
Mhm.
they're looking at that 30-minute mark and then they want to eat like some form of protein because they just broke down muscle.
Yeah.
And I always ask them, where did you get that? And, like, because you've not said that at all.
Yeah.
So do you know anything about that? Or
In
that
terms of
trend, or-
protein, so pediatrics is a very interesting population because I think in the studies that I looked at is that if they did less than an hour workout, so it's like 45 minutes, it shows that they are doing protein synthesis. So their muscles are working to build up this protein, but the breakdown actually, there's not a lot of breakdown in protein. So my point in that slide is to really like have your basic daily recommended protein intake based on your age. And that is usually enough to supplement them or to have a baseline of protein per day. So it's not, they don't have to take like extra per
30
se.
minutes after the
Yeah.
looking for a piece of chicken. Yeah, meal.
Yeah.
So
Yeah.
going kind of piggybacking off of that, how do you feel about protein supplements, like casein proteins, protein powder type?
So protein supplements, I think, can be safe if we're monitored. So if we know how much they are taking, then that is, and they're telling us a certain amount, or if there's a sports nutrition, or if it depends on also the situation they're taking it in. Like, why are you taking this protein? If you ask them, like, they're like, hey, oh, I just want to build muscle most of the time. And that needs to be monitored. It's like, hey, how much protein are you taking? Because if you're doing just your basic workout that's less than an hour, then you really don't need to. However, if you are trying to bulk up muscle, then there is a general consensus of taking like more than 1 gram per kilo per day of protein. And so that tells us like, hey, maybe we need to do a diet diary, like really know what their typical daily intake is like. And that's where the multi-disc approach kind of comes in, if we have access to that, because not a lot of us have access to a sports nutritionist per se, but to kind of look at the community with like their coaches, their athletic trainers, to kind of get more history in that sense. But
And
mhm.
is there an advantage to protein powder over just protein in your diet?
That's a
Like
great
for
question.
someone who's trying to build muscle mass, trying to work out.
There could be, but I think the general consensus for pediatric population is to get it from your diet versus an actual powder form. So things like that piece of chicken might be helpful if that's what they're looking for versus powder.
One thing is having different students from different ethnicities.
Mm-hmm.
And so I always wondered in looking at bone structure of some of more dense bone, working with Alaskan or Native American
Mm-hmm.
versus other populations. And I saw in your chart that you had moved into activity, but I've never really seen anything that takes into consideration just some of the genetics of
Yeah.
bone density and just what these students have to carry around. And I think part of it is inspired because the comment Shaquille O'Neal's mom talked about as she was raising him, that
Mhm.
she had gone by a lot of this nutrition stuff. Her kid would have starved.
Yeah.
He would have never become who he was based on, what we knew back then.
Mm-hmm.
But I always thought that was interesting in these different ethnicities that we don't look at what it takes for that body, genetics, hormones, and the nutrition and sports. Because,
Yeah.
working with underrepresented populations,
Right.
you're looking to see what do they have access to.
Exactly.
And then trying to figure out how you can help them move into a wellness, lifestyle.
Yeah, I think to reiterate for those who are still listening is looking at the different body builds, the genetic makeup component, and how that contributes to, or what we can do to counsel them on like what to eat. Because they're actually, although nutrition is a super hot topic, there's not a lot that's done looking into the genetics, looking into the ethnicities and what contributes to an individual's growth, especially in the pediatric population. So that's like a great area where we could definitely expand on that, but not a lot of people have looked into it. So I'm glad you brought that up. Yeah. Mm-hmm. There's not a lot of studies. It's starting to, like, even when I talked about the creatine part, like in 2009, we're like, no, let's not do creatine in these younger age populations because we don't know enough. We don't have enough to know to recommend exactly. But now, like, yeah, now like 10 years later, we're like, hey, actually, it could be safe if you're monitored and if we know what you're training for. So it could be beneficial. So a lot of things are continuing to evolve. So yeah, it really is. There's just a lot, a lot. So I'm also learning as well as I did this talk. So anything else?
I've got any questions for you in the chat. So.
Okay, cool. Well, thank you.